Today we're discussing corporate health assessments, a topic which there's increasing interest. They're being offered by a variety of companies, but importantly, there are varying efficacy and quality and price. And today we're trying to tease some of these issues out so that you'll be able to make a more informed decision for you and your company.
Hello everyone and welcome to another episode of the Wealth of Health podcast. My name is Ahmed. I'm the CEO of Echelon Health, and with me as always is Dr. Paul Jenkins, Medical Director, Consultant Physician and Endocrinologist. Paul.
Welcome.
So as you mentioned, we're talking about corporate health assessments today. That's quite a big topic because certainly I've had that in my career as well. You're just employed and your employer says, well, we're giving you health insurance. Fantastic. And most probably it comes with a health assessment of some sort. So a health check that you would have every year. If you care about your health, so you would volunteer and go and get your health assessment done. But then you don't really know what sort of efficacy that health assessment that you had offers, or if this is the best, or what should you be concerned about. But I'm going to ask you first, can you give us an example of a typical health assessment that an employee would get offered by their employer?
Yeah, well, very much so, yes. I mean, Ahmed, this is a topic that clearly I know and we know a lot about because we are associated with Echelon Health, which we like to think is one of the leading providers of top quality health assessments. I haven't looked into this and it's been a long-held passion of mine for almost decades now. So, I mean, and this is one reason why, to some extent, we established Echelon Health, was to counter some of the myths, potentially, and the pitfalls of some of the more basic health assessments.
Right.
And these are, it's a difference between whether you treat somebody as a statistic and looking at the risk according to population-based statistical risks, or if you look at them as an individual and try and tease out, do they or do they not actually have a disease? And this is really the big differentiator between them. So a standard company health assessment would use a variety of blood tests and the exercise treadmill test, put them on the treadmill, yes, and try and gauge their risk of whether they might be developing disease in the future.
So yes, actually the two most common, I would say, employee health assessments out there are exactly that. They're a group of blood tests, and the more advanced one, or the more comprehensive one, offer the treadmill.
Yeah.
A lot of people don't know what the treadmill is. They, you run on a treadmill with some attachment to your body, and then also a lot of people think that this will tell them whether or not they have cardiac issues or risk of heart disease.
Absolutely.
So, is it an effective method of identifying if someone has a heart condition or not?
Yeah.
And is this form of health assessment enough really to tell you anything about your individual health?
The short answer is no.
Oh, okay.
The slightly longer answer is the treadmill test was never designed for screening for subclinical asymptomatic heart disease.
Right. Okay. This is what they call the stress echo.
Yes. No. That's a different.
That's a different thing.
So the exercise treadmill test, which is in essence, you are put on a treadmill. Yes. You're wired up to your ECG. It is taking a continuous electrocardiogram, so recording of your heart. Yes. Right. And as both the speed of the treadmill increases every sort of 3 minutes, there's something called the Bruce protocol. So it goes up 3 minutes, and it also increases the incline of it. So basically, you're working harder and harder.
Okay.
Your heart rate will go up. Yes. And the idea is that if you have a critical narrowing of one of your heart arteries, and as your heart muscle, the myocardium, requires more blood flow just to keep pumping and to keep up with that increased exertion, then if there's insufficient blood flow because of the narrowing, it will show up on the ECG.
Right.
So it can detect very late stage established coronary artery disease. And that there's, But we are talking, and the point of screening, the whole point of screening in my mind, and most people would accept, is you're trying to detect disease at the earliest stage possible.
Right.
Because then that allows you a much bigger window of opportunity to do something about it and to prevent it from progressing.
Right. So a lot of people also will go through this health assessment, and it will include things like, lifestyle questions. So they will get asked, how do you drink alcohol? How often do you smoke? How often? Do you exercise? How often? And they measure weight and height, give, kind of a BMI measure. Are these data really that important? What do I know about myself when I measure my BMI and put all of these lifestyle data in? I mean, what does that tell me about my health, really?
Again, not much.
Not much.
Not on an individual level. And
Okay.
that's what this is all about. Again, statistically and for the population, those people who are overweight, yes, or do less exercise, or their lifestyle, or smoke, or drink too much alcohol, yes, they are more at risk of developing disease. But it doesn't necessarily correlate to you as an individual. And that's my big bugbear about this is I want you know if you're not exercising, if you're overweight.
Yes, exactly.
You know if you're smoking.
Yeah.
And the temptation of all these medicals, health assessments is, fine, doc. Okay, yeah, great. See you same time next year, same place. We'll have the same conversation. Yes.
Exactly.
And nothing really is going to change.
True. It doesn't. So these are data that then gets inputted in that
Population-based
platform.
That's
population-based
the
data
issue. Yes. It doesn't tell you. Is there something wrong with me?
So are you telling me that I could be, and that's not by any means an invitation to do that, but I could be smoking and drinking and not exercise much and all that, and I could be at a moderate or low risk of a heart attack?
You could do. Yes, because as we've said before in one of these episodes, I think the reality of whether you as an individual get disease is approximately a third genetic, a third is lifestyle, and a third is chance. And there's slight variations of that, but so you can have an appalling lifestyle, and that's what, you always hear, oh, Granny, she smoked till she was 19, survived, didn't get lung cancer.
True.
Yeah? That should not be translated to everybody.
Of course.
But she was a lucky one. But equally, you can have a third of people who have a heart attack have no risk factors.
Sorry, can you say that again? This is very important. A third of people who
suffer a heart attack have a completely clean, healthy lifestyle and have no apparent risk factors. So it's their genetics and just chance.
Right.
So, using a population-based risk algorithm, yes, such as blood test and a treadmill test, yes, is not the best way of determining your risk. Okay. And that's where I can come in and feel so strongly about it, because with modern imaging techniques, yes, and the use of modern scans, we can see inside your body, not yours personally, but I can if you want to.
Mine included.
Yours included, yeah. But someone's coronary arteries with a resolution of 0.3 of a millimeter. So I can tell you utterly objectively, do you or don't you have heart disease? Many, many years before it causes symptoms.
Right.
And that knowledge is so powerful because based on the hundreds, thousands of patients I've seen, there's no one I've met who ignores that message, information, that image, and says, oh, doctor, it doesn't really matter, I'll see you next year. You've got their attention, because even if it's clear, and you'll say you're lucky, you've got your coronary arteries are completely clean, you're lucky, the first response is fabulous. How do I keep it that way?
Right.
And even if you do have heart disease and you want to do something about it, the first response is, okay, how do I stop it from getting worse?
Right.
Because you've taken it from the abstract of, oh, well, it could be me, it won't be me, to, whoa, this is me, this is personal, this is my heart, my arteries, I'm concerned about this, because it's personal information.
The statement you get of your likelihood of developing coronary heart disease or suffering a heart attack over the next 10 years is 30% does not mean anything.
It's a risk, but then we all know the risks of living.
But that's almost, to a varying degree, that's almost every single person in the population.
It could be, yes.
So
It's
without,
not, I mean, you will have varying degrees, but as I said, even if you're given one of these so-called Q risks that's very low,
yes,
it doesn't relate to you as an individual because there are always exceptions.
okay,
And conversely, a very high score doesn't relate. So having this powerful individual information, and that's what in a company, and we started this with the corporate level,
yes,
can be so powerful to a company. I started this and I got involved with many, many years ago when we were offering the coronary artery CT scanning to a very, very large company. Yes, they were having one or two of their senior executives a year dropping down from a heart attack.
right,
And at a senior level, of course, there's a tragedy on a personal level to the individual, them and their family. But on a company level of employing the loss of work, income, and the hassle and expense of replacing a senior executive, senior member of your team is massive.
yes, and also the impact on company culture when
Yeah.
you physically save the life of your employees.
Yeah.
That changes the company culture completely. The sense of loyalty and
Shows your
engagement
caring.
from all your team members is just it's unparalleled. So
So, sorry, I mean, just following up from that. So when we completed this program and they underwent regular CT screening of their coronary arteries, the number of people having a heart attack, zero.
zero.
They didn't have any in the 5 years that we followed them up for this program.
Wow. I mean, every time you open the newspaper, when you open the newspaper every day, there's some sort of piece of news about a senior executive who died of a heart attack or had a heart attack at such a young age because of work-related stress.
Yeah.
And I always immediately think to myself, I'm pretty sure this company has a health assessment in place. So why did it not detect that?
Yes.
Why? And the answer you just gave me is that it's primarily based on statistical probabilities, and these are not definitive by natures, and they do not look at you as an individual. There's a study here I'd like to mention to you to get your take on it. According to a study published in the Journal of Occupational and Environmental Medicine, high-level executives are 40% more likely to die from heart-related issues than their lower-level counterpart. Furthermore, a global survey by the World Health Organization found that individuals in high-stress jobs like those at the C-suite level have a 23% higher risk of a heart attack. So what are employers doing about this?
Well, I mean, firstly, none of that surprises me at all. I mean, the stress of chronic severe stress, yes, a sedentary lifestyle, that can certainly increase your risk. Employers, what they're doing about it, well, for many of them, they are being probably brutal, paying a bit of lip service. They're having a corporate health assessment. We've done what we need to do, tick that box. Yeah, this is just unfortunate.
I wouldn't necessarily blame them because I speak with a lot of heads of benefits and chief people officers, and the problem is there is no technical knowledge of what is good and what is bad. And whoever sells them this health assessment is like, this is your standard, or this is the best corporate. They use words like comprehensive, or this is the latest technology. And if you're not a medic, there is no way you would understand whether or not this is. So that's the biggest consideration, my own observation. The second is cost, because the second you say, we need to add a scanner, an MRI or a CT, the cost skyrockets.
Well, comparatively, it depends on what value you place on
that's
accurate information.
So the generic, without mentioning names, health assessment, corporate health assessment out there is 1,000, 1,200 every year, cost per employee. This is the highest end one. But would you benchmark that against something that includes a CT scan, for example, that you can have once every 3 years? Would you say that's a comparative price?
I think so.
Yeah?
Yes. I mean, and if you have a clear CT coronary artery, you're going to be clear and free of heart disease for at least, I would say, 3 years. Perfectly reasonable to repeat that every 3 yearly.
Right. So that's the other thing. Within any organization, it's pretty much always a standard health assessment for everyone. Would you say that's a wise decision or an effective use of a health assessment product? Because you will have senior employees who are 40 above, 50 above, and they have a completely different risk profile than people in their 20s and 30s.
Yes.
Would you say you should also offer the health assessment to people in their 20s, or is there an alternative product?
Okay, yes. You shouldn't offer the same one to all age groups, because as you say, the risk and the disease changes as we get older.
Right.
So you're not, in your 20s, 30s, you are not going to die from a coronary heart event, unless you're extraordinarily unlucky or you've got a very, very strong family history.
Right.
It doesn't happen, but it is a illness that affects people in their 40s, 50s, 60s. So you should tailor your product according to your age, according to your gender, and also, I think, according to what disease you are most concerned about. Yes, because
Right.
that's another key factor, that you need to use the right tools for the disease that you're looking at. So for a coronary artery disease, which is the biggest killer still overall,
Yes.
it's a CT coronary angiogram is a definitive assessment. If you're looking at brain disease, or if you're looking at cancer, then probably an MRI scan could be the
Right.
best option. If you're looking at prostate cancer, it's a high quality so-called 3T MRI scan.
Okay,
So,
let me just touch on the point of the CT, because because we know that there's a general fear of CT. A lot of people think it's it's a very, very dangerous tool to use to diagnose or for prevention. And part of it, I think, is legacy.
yes.
Probably the NHS has warned people about the use or the overuse of CT machines, generally speaking, but also science has moved on quite a bit when it comes to this technology. So can you tell me, or is there a survey or a study that's been done on the impact of the radiation that comes out of a CT machine?
No, it's all theoretical knowledge, still based on old data from the atomic bombs, Hiroshima. It's all extrapolated from that data that radiation is bad.
I'm sorry,
There's no active data, it's all supposition. But let me also tell you, we know most people accept that excessive radiation is bad for you.
right?
Okay.
Yeah.
Quite what excessive means is under debate, but it's all very strictly regulated in the UK by something called IRMA, the Ionising Regulation Act. Yes,
Right.
which places strict rules on the on the rules that who you can radiate.
Right.
Yeah. But having said all of that, the CT scanners, and even in the 15 years since I've been involved with them, there's been such marked technological advances in them, the dose of radiation is probably down by 90%. So 10% it was. Yes.
Okay.
So the most common scan now, and also hang on, as a caveat about the NHS, is the CT scanner, the demand for CT scanning has just rocketed over the years. Year on year, it's getting more and more.
Okay.
And nowadays, if you go to casualty, virtually almost any patient with a significant disease or significant symptom is undergo a full body CT scanner in the emergency department.
So it cannot be that bad in a way.
Those are the facts. You can say, oh, it's bad for you, the radiation, and that's a full body CT, so the dose of that is much higher.
And it's also a risk versus benefits.
It's a
exercise, right?
Absolutely.
Depends what you're looking for. Okay.
For a slim person having a heart scan now, it's equivalent dose to you going on holiday in Cornwall for 2-3 weeks because of background radiation there in the granite rocks.
So my logic to that is, does everyone who live in Cornwall have higher risk of cancer?
Correct. And there are also parts in the world where the background radiation dose is extremely high. There's not an increased risk of cancer.
Okay.
So notwithstanding that, if you're having it every 3 years, it's not an excessive risk at all for the power of the knowledge that it can give you. So let me just give you an example of a recent audit that we did where senior company in the city asked us to perform cardiac screening of their employees and of their staff, of the men aged over 50, and none of them had any symptoms at all. 1 in 4 of them had so-called triple vessel disease. So that's flaring up, affecting all 3 of their main coronary arteries.
And no symptoms.
No symptoms. And in 1 in 3 of them, they had at least a blockage causing more than 50% narrowing in one of their arteries.
That's fascinating.
So these people are at real risk of developing a heart attack in the future. But, because we detected it at this stage, you can then put them on aggressive, what's called so-called primary prevention.
Yes.
And, vastly reduce the risk of it. And I would say that since we started doing this program for them, they've had no heart attacks.
That is fascinating. So question, did this company have an existing regular health assessment product?
Yeah,
They did.
They had a regular, the ones you've described.
And they did not detect any of that?
Didn't detect any of it.
Okay, so I actually think that a lot of companies want to do the right thing. They want to do right by their employees, junior and senior. Yeah. But not all companies have a clinically trained person in place.
Yes.
Those decisions are heavily bound by budgetary constraints, also by reputation and recommendation from someone tried something, or simply the most popular option. This is the most popular, this is the biggest company, so I have to sign up with them. So
you probably can't get criticized if you're with the most popular and the biggest company.
Absolutely right. So let's just play a scenario. I am the head of benefits of XY company, or the HI director, and I would like to put something in place in terms of health assessment for my employees. What questions should I ask the company that's trying to sell me that product?
Okay. Firstly, I suppose, are you offering the same for all ages? Yes.
Right.
What's the efficacy in detecting disease? How effective is it in actually detecting disease rather than statistical risk?
Okay.
Those
any other
the
questions?
2 ones. And what tools do you use?
Like what imaging modalities?
Well, do you use any imaging modality, or is it all blood test and questionnaire?
Right. So the second one you mentioned is, what is the efficacy? What diseases can you detect?
Yes. Can
you actually answer that question if you're offering one of those generic health assessments?
No.
You cannot.
No. But, okay, they'll detect some diseases on blood tests.
Well, they can tell you if you have high cholesterol, for example.
Or do you have sugar diabetes? Yes.
Or diabetes. Yeah.
But those are...
But hopefully if you have diabetes,
Yeah.
I mean,
but it's not going to tell you, do you have objective evidence of early disease? And that's, again, I will come back to it, whereas the imaging does.
Can it tell me if I have lung cancer?
No.
Can it tell me if I have colon cancer?
No.
Can it tell me if I have brain tumors?
No. Can tell you if you have any cancer. Possibly the only one would be a leukemia, maybe lymphoma.
Because it's a blood test?
Yes, on the blood test.
Okay. Can it tell me if I have 80% narrowing of one of my major heart arteries?
Can't tell you any narrowing, even 10%, which is what a CT scan can show you.
This is unbelievable. And this is I wouldn't say sold, but this is offered to thousands and thousands of companies.
Portrayed as often as the gold standard, the most advanced.
Okay, another theory would say, well, what's the harm in that? I got a health assessment for free. Surely it will tell me something.
Well, no, the answer is, for the reasons we just said, no. And the big concern is that it induces a sense of false well-being. I've had a health assessment, it's all clear. So then if somebody ever had symptoms, they can ignore. Some evidence people ignore the symptoms because, I had a health assessment last week, it's all fine.
Right. So give you a false sense of,
Both, it can give you false sense of well-being and a false worry. Because if you're said, you're at high risk of something, well, you might be, as we said earlier, statistically high risk, but that's not necessarily you as an individual.
Okay.
So you think, I'm going to get a heart attack, or I've got this big illness, and you could certainly be okay.
So if I'm the head of benefit or HR or a CEO of a company, and I want to put in place a health assessment program, really I should be taking a little bit more time to dive deeper into the details of what's included in that health assessment. And the 2 biggest questions are, what is the efficacy of the health assessment? And is it the same for everyone, regardless of gender and age?
And can you really detect the disease?
And can you detect the disease?
So we can then put in place an effective prevention program to stop it from progressing to cause symptoms and or death.
Okay. And do you recommend that health assessments are normally had every year, or?
The ideal world is probably a full, so-called the full Monty, a detailed one, 3 years. And then you can have an interim scan at 18 months.
Okay.
Yeah.
People want to be definitive about healthcare, and I know it's very difficult, but does this guarantee I won't get sick, or if there's something I will definitely?
No, but it's as close to, it's the best that modern medicine can offer. We have at Echelon, we have a medical advisory committee of very senior physician specialists who advise us on the appropriate screening in their field. And, I've done our own work looking at the ONS, Office of National Statistics, mortality data.
Yes.
And we know that using our definitive assessment, you can detect 92% of the causes of death in men and 95% in women.
So that's a number. That's
no,
efficacy. So why can't everyone, apply the same method and give a percentage?
Their health screening won't detect the disease.
Wow. So could we say that it's close to zero, those generic health assessments that are?
As a population, if the whole population had them, they probably would save
Right.
some people. But again, repeat, not for the individual.
Not for the individual.
And that's what I'm so passionate about, is treating as an individual, yay or nay, you've got disease or not, we need to treat it.
Well, I think on that note, we're going to leave it there. Thank you very much for watching. And if you are an employer and assessing a health assessment product, please take the time to dive deeper and apply some of the tips that you may have heard on this episode. From me, thank you very much, and we'll see you on the next one.
Goodbye.